key takeaway message of our article is that obesity and hypertension independently and jointly lead to an increased risk of incident heart failure when analyzed in a stratified approach. Particularly, participants with both obesity and hypertension together carry an 86% increased risk of incident heart failure when compared with those with just obesity alone. My name is Arslan Hamid, and the title of our study is The Independent and Joint Effects of Obesity and Hypertension on Incident Heart Failure, a pooled cohort analysis. The study has been accepted to be published in Mayo Clinic Proceedings. The main findings of our study are that in a stratified analysis, we were able to identify that obesity and hypertension independent and adjusted for other risk factors, so particularly obesity independent of hypertension when adjusted for other risk factors associated with a 60% increased risk of incident heart failure compared with participants with neither, and hypertension independent of obesity adjusted for covariates was associated with 110% increased risk. This is over a twofold increased risk compared with participants with neither obesity nor hypertension. When we look at the presence of both together, obesity and hypertension, they were associated with a 197% increased risk of incident heart failure. That's nearly a threefold increased risk compared with participants with neither. Very importantly, what is the incremental risk? So the presence of hypertension with obesity compared with participants with just obesity is associated with an 86% increased risk for incident heart failure. And these findings were consistent when we subcategorized classes of obesity and hypertension and found that increasing classes of obesity with and without hypertension and vice versa were associated with an increased risk of incident heart failure. Now, our data overall demonstrate that weight management should be considered to decrease the risk of heart failure. This is particularly important in those participants with existing heart failure. And this is even more important when we take into context the recent CKM guidelines that were published, which highlight that the first stage of CKM is in fact increased weight and obesity. And when we look at the recent GLP-1RA trials, now studying GLP-1RAs for weight loss and the treatment of heart failure in those with existing heart failure, this is all the more important. And for patients, this means that the management of obesity is a key factor to decrease the risk of new onset heart failure. And the next steps in terms of future research, is that future trials are needed when treating obesity in participants without existing heart failure to demonstrate if there is indeed a prevention effect on incident heart failure by treating obesity. We invite you to read more about our article in the upcoming issues of Mayo Clinic Proceedings. Thank you for your time.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.